Hello, students. This is Anas Awad, a certified trainer and researcher in sports science. Today, we will explain joints in a scientific and applied manner and their relationship to sports training. Any structure in the world that is meant to be stable and strong must have a firm foundation and a solid framework. The same concept applies to the human body. At the beginning of its formation, the body relies on the skeletal system and the bones contained within it. Bones are also the fundamental component of the musculoskeletal system, which we explained in previous courses on our channel. What is the musculoskeletal system? As we know, students, the human body is made up of a group of vital systems and organs responsible for operating the body and carrying out its biological functions. The musculoskeletal system is one of these systems. It is the system responsible for supporting the body and giving it its shape, enabling movement and stability, contributing to the protection of vital organs, and maintaining balance and daily motor performance. In essence, the musculoskeletal system is what enables you to move. This system consists of several interconnected elements: bones, the primary foundation, then cartilage, ligaments, tendons, and finally, muscles. This complete ensemble is what gives the human being the ability to move, maintain stability, and control the body. The human body is composed longitudinally of a skeletal framework, yet the bones within this skeleton do not form a single connected piece. They are separate bones. Each bone has its own shape and size and differs in its location and distribution throughout the body according to where it is needed and what function it serves. The question then is, how do these bones come together and connect? This is where joints come in, and that is the topic of today's lecture. A joint is a place or point of meeting or connection between two or more bones. It is the element that permits movement and at the same time defines its limits. A joint, in short, is one individual bone on one side and another individual bone on the other, meeting and connecting at a point we call the joint. However, the matter is not simply a case of one bone resting on another. If bones were to directly contact each other without any system in place, there would be severe friction. Movement would be painful and exhausting, and the bones would keep grinding against each other until they caused serious problems. That is why the body contains other components beyond bones and joints alone. God Almighty created additional components within the musculoskeletal system to ensure safe and organized movement, through the connection and cooperation of bones and joints with other anatomical components, forming mechanical loads along which force and resistance travel, in addition to protecting the vital organs. This is where the other components come in: cartilage, ligaments, tendons, and muscles. Each element has a specific function, and together they create smooth, powerful, and safe movement. Cartilage is a flexible yet firm tissue, a cushion that separates bones and reduces friction within the joint, while absorbing shocks and distributing loads. Cartilage allows bones to move freely without pain or wear. Ligaments are fibrous tissue or strong cords that bind bones to one another, stabilizing joints and preventing excessive or unnatural movements. A ligament is the safety belt of the joint, protecting it during movement and preventing sprains. Tendons are strong, flexible tissue that connects bones to muscles. Muscles generate energy, force, and movement through contraction in order to move the skeletal framework and maintain posture and stability. Tendons are therefore the bridges that transfer the force produced by muscles to the skeletal framework, so that movement in the bones occurs as a single unit. To tie them all together, bones provide support and shape. Muscles produce force through muscular contraction. Tendons transfer muscular force to bones. Ligaments stabilize bones within joints, and cartilage reduces friction, absorbs shock, and protects joint surfaces. The result is movement in the human body, enabling a person to engage in various physical activities in daily life and in the gym. As a coach, whenever you observe any movement or exercise, recall the interplay occurring between bones, cartilage, ligaments, tendons, and muscles. This understanding will give you a solid foundation to later analyze sports biomechanical movements. Types of joints. The joints that connect the body's bones are not all alike. There are three main types, each with its own range of motion and mechanical characteristics. Some joints are designed for stability, while others are designed for movement. All joints in the body branch from these types and are distributed in various locations according to their function and where they are needed to perform a specific movement. Type 1. Fibrous joints. This type is nearly fixed, does not move, and produces no movement. Its sole function is to bind bones together, stabilize them, protect them, and ensure they do not move. Examples include the gomphosis, which fixes the teeth within the jaw to generate force during chewing; syndesmoses, found between the bones of the hand and forearm, binding bones with long, strong ligaments that allow almost negligible movement while distributing forces such as gliding or rotation; and the skull sutures, which bind sections of the skull bones together with strong fibrous tissue, functioning to protect the brain and maintain the shape of the skull. Type 2. Cartilaginous joints. This type can move, but only within a limited range, such as the joints between the vertebrae of the spine and the joints of the pelvic bone. These joints reduce shock, bear weight, and permit limited movement such as flexion, extension, lateral bending, and simple rotation. Type 3. Synovial joints. These are the freely mobile joints, and this type is the most important in the field of kinesiology and sports training. Synovial joints exist in various forms at locations easily visible in the human body, such as the elbow, shoulder, knee, and hip, unlike fibrous and cartilaginous joints, which are generally difficult to see because they are located in the skull, teeth, spine, and pelvis. For coaches, understanding these joints is extremely important, as each joint has its own movement pattern and defined limits that must not be exceeded. Knowing the natural range of motion for each joint helps the coach choose the right exercises, improve performance, avoid injuries, and strengthen the muscles surrounding the joint. Additional classifications. Beyond the primary classification, scientists have established three further classifications. By function. Based on the function and movement performed by the joint, three types. By axes. Uniaxial joints allow movement around a single axis only, providing simple, directionally defined movement. Biaxial joints allow movement around two axes, balancing mobility and stability, the most stable and least mobile. Multiaxial joints allow movement around three or more axes, providing the greatest range of motion. By articular surfaces. Simple joints. Two bones meeting within a single joint capsule. The joint capsule is a strong, flexible enclosure surrounding the joint, stabilizing it, preventing excessive movement, protecting it from friction and shock, and containing the synovial fluid that facilitates bone movement. Compound joints. More than two bones within the same joint capsule, with greater complexity and multiple bony segments participating in movement. Complex joints. A group of bones with additional internal structure that helps distribute pressure and improve stability. Synovial joints in detail. Part 1. Synovial joints are characterized by three features: a joint capsule, synovial fluid, and cartilage on the ends of the bones. This design allows extensive movement, but at the same time makes them more prone to injury if used incorrectly. A sports coach must have a thorough understanding of the structure and movements of these joints. Synovial joints are the most important joint type for athletes, as they are responsible for free movement in the body. Virtually every exercise we perform relies on a synovial joint. If a coach does not understand the type of joint they are dealing with, they will focus on the muscle and forget the foundation upon which it moves. Knowledge of the joint helps you choose the right exercise, identify the safe angle, understand the natural range of motion, avoid improper loading, and reduce injuries. First, the hinge joint. This joint resembles a door hinge and is a uniaxial synovial joint. Its primary movement is in one direction, flexion or extension, The bones in this joint are designed to move forward and backward within a single track. Examples in the human body include the knee, elbow, ankle, and the interphalangeal joints of the fingers and toes. In kinesiology, this joint performs flexion and extension, knee flexion and extension, elbow flexion and extension, ankle flexion and extension, and finger flexion and extension. All mechanical movements occur in one direction only, forward and backward. In sports training, exercises that work the hinge joint include squats and lunges, knee flexion and extension exercises, biceps and triceps push and pull exercises at the elbow, and calf raises at the ankle. Problems arise when we attempt to load the joint with a lateral movement or rotation it is not designed for, especially at the knee, which significantly increases the risk of injury. Second, the pivot joint. This is a uniaxial synovial joint that allows rotational movement around a single axis. One bone rotates around another. A clear example is the cervical joint between the first two vertebrae, as well as the pivot joints of the forearm. In sports training, movements such as forearm rotation and certain boxing or throwing movements rely on this joint. Overloading it at high speeds can place stress on the surrounding ligaments. In kinesiology, this joint performs rotation, such as rotation of the head and neck, and rotation of the hand inward and outward. Third, the saddle joint. The bone surfaces in this joint are simultaneously concave and convex, shaped like a saddle. This design allows flexion, extension, abduction, adduction, opposition, and compound circumduction. A clear example is the carpometacarpal joint at the base of the thumb, which is critically important in grip training and weightlifting as it is essential for controlling the barbell or dumbbell. The sternoclavicular joint is also classified as a saddle joint, permitting multiple shoulder movements with good stability. In kinesiology, this joint performs thumb flexion and extension, thumb abduction and adduction, and opposition of the thumb to the remaining fingers. Synovial joints in detail, Part 2. Fourth, the ball and socket joint. This is a multi-axial synovial joint consisting of a spherical head of a bone that fits into a circular cavity in another bone. This design allows movement in multiple directions: flexion, extension, abduction, adduction, internal and external rotation, and even full circumduction. Examples include the shoulder joint and the hip joint. Most upper and lower body exercises rely on this joint due to its wide range of motion, making it highly flexible. However, it simultaneously requires strong muscular stability and is susceptible to dislocation and recurrent injuries. It is in fact the most injury-prone joint type in the human body due to its large range of motion. In kinesiology, this joint performs shoulder and arm flexion and extension, shoulder and arm abduction and adduction, internal and external rotation of the shoulder and arm, compound circumduction of the arm, and hip flexion, extension, adduction, abduction, and full rotation. Fifth, the condyloid ellipsoidal joint. This is a biaxial joint. Examples include the wrist joint and the metacarpophalangeal joints. In sports training, this joint plays an important role in grip exercises and fine movements requiring high levels of control. In kinesiology, this joint performs flexion and extension of the metacarpophalangeal joints with lateral deviation of the fingers, abduction and adduction of the finger joints, abduction and adduction of the wrist joints, and circumduction of the hand when wrist movements are combined. Sixth, the plane, gliding joint. This is a non-axial synovial joint. It does not rotate around a clear axis. Its movement is a small gliding motion in several directions. The bony surfaces are nearly flat and slide over one another with limited, simple movement, gliding forward and backward, with no distinct flexion or extension and no circular movements. It has many examples in the joints between the carpal and tarsal bones. Despite its small range of motion, it bears considerable pressure, especially in push-up exercises, planks, and balance exercises. People often underestimate it because it is not visibly obvious, but in reality it is subject to high stress in certain exercises and is critically important for stability and fine motor control. God willing, in upcoming lectures we will examine synovial joints in further detail and connect them directly to sports training practice. And with that, today's lecture comes to a close. Thank you all, and bye.